Good evening, Mr. Bartlett. So I have three questions to ask you.
Okay.
The first one is about tumor board. So do you have a systematic reviewing of all surgical cases of peritoneal carcinomatosis performed before surgery? So
Yes.
do you have
yes.
a tumor board for all cases?
Yes. Yeah. Each case is presented in front of a group of surgeons, medical oncologists, radiation oncologists, pathologists, radiologists, and we discuss each case and come up with a treatment plan.
Okay. And if you disagree, what kind of discussion is performed? Like everybody just give his advice, or how do you make a clear cut?
Usually, we do sometimes disagree,
Okay.
and sometimes it's a matter of whether we want to go straight to surgery or we want to start with chemotherapy, for instance. And often, if we do disagree, then both of the different approaches are presented to the patient, and we kind of leave it up to the patient to make the decision as to how to proceed. So if there's really not a consensus of opinion, then we present it all to the patient and give them the choice.
Okay. Okay, so my second question was what kind of actor was involved. So you already respond to that. So my other question: do you think that international or national multidisciplinary staff for difficult cases can be organized? And how and with which frequency do you recommend it?
I mean, if I'm understanding you correctly,
yeah.
we hold in the United States a video conference that's on a national level.
So it's national.
And so we do it every 3 months.
Okay.
And there are anywhere from 20 to 30 centers that are all participating in the video conference. And we ask for cases ahead of time, and so difficult cases are presented and discussed. And there are ways that people can log in through the internet or through a video feed. And anyway, it allows us to discuss and try to kind of be all on the same page in terms of how we manage the disease. Now, that can certainly be done on an international level, but the time changes are challenging.
Yeah.
We do engage a group in Spain, then their time frame is such that it's about midnight when they're participating.
Yeah.
And so, but we have been able to present some of their cases. So I think it's important, and it's nice to bring the whole community together and just make sure that we're thinking along similar lines. And so I think it's feasible. And if it can be done, every 3 months, it's probably reasonable.
Okay. Thank you. Thank you for your time.
That was easy.
Yeah.
Very good.